Hi, I'm Madeline Tynan from the Tynan Motor Group, and today we have Associate Professor Greg Davis with us to be empowered. How are you, Gregory?
I'm well, thank you.
Now, we've come together as a community. We sit on a board together, the SSMRF, and you have your own business in Cogra, looking after women, babies, all that sort of thing. But I just want to have a chat with you. I know through the SSMRF you said you were working with St George Hospital currently on the hospital arrangements with the coronavirus. As a business like us, and obviously the hospitals are a business, how has that impacted and what are they doing to mitigate what's been going on?
Well, it's been huge. I mean, it's been working at a number of different levels. So I've been involved with the junior doctors, so the ones who are interns and residents and registrars at the hospital, but there's been an overall plan for the whole hospital as well. So there's a COVID committee. I think the real problem with the virus has been the concern that you could actually have one person at the hospital who's infected in the staff, and it's going to knock out a whole group of other doctors and nurses, and that is the big problem. And then you would take out a whole lot of staff, and then if the pandemic...
Take out a whole section. Really,
yeah, whole section. So if someone, they estimated, for instance, in emergency department, if you had one of the registrars in there who was infected just in one shift, that would take out 7 junior doctors and up to about 10 to 15 nurses as well. So all those people would be quarantined. So there have been huge plans kind of brought into place. Currently, it's actually going really well. We're doing fantastically well in this area.
So does private hospitals, you work in a couple of the different private hospitals?
Yeah, the private hospitals are prepared to take extra patients if the public hospital was overcommitted. But that hasn't needed to happen at all, and doesn't look like it's going to happen at this stage.
So we all think, being in business, that we're the ones affected. But obviously it must affect the doctor's income as well too, especially working in the private hospitals, because they've had to release beds, etc.
Well, the real big thing is elective surgery. So, all the surgeons that do elective surgery, like orthopedics, and
that's all stopped.
And that's all stopped. IVF, which is part of the work that I do as well, that's all stopped. People have had to sort of put their fertility aspirations on hold, and so, but I think it's really affected the surgeons probably more than the physicians. The physicians have had to do a lot more telehealth and talking to patients over the phone, but the surgeons haven't been able to do their procedures, which is how they make their money. So,
right. And the virus doesn't seem to be attacking mothers that are pregnant.
No, it's good news for pregnant women. So it doesn't seem, which is unusual for pregnancy. Usually pregnant women are more likely to pick up viruses like influenza and are more likely to be severely affected. But with the coronavirus, that's not happening. So they seem to be about the same as women of similar age, but they're actually less likely to get the severe forms of coronavirus disease.
And I've seen overseas that they've cut it out, that even dads aren't allowed in when babies are born. Australia's not looking at that model?
No, I mean there was talk about it a couple of weeks ago, but currently all both the public and the private hospitals in our area are allowing fathers to come in. No children, no grandparents, but which is difficult for grandparents, but
especially since my daughter's having twins. But yes,
but yes, that's for the foreseeable future, I suspect. Certainly for the next few months.
Next few months. Yeah. That's what you're thinking.
Yeah.
Okay, so getting on to then impacting health workers. When you say that, like obviously, we can't get by without them at the moment. I think. My daughter was saying, like, we all put these movie stars up there and all these people that are really nobody. And then we look at our doctors and our nurses that are putting their lives at risk. How's that mentally affecting the hospitals and the workforce?
Yeah, it has been a big worry. I think some people tend to be more affected than others, but there are lots of little things, like in all the hospitals now, as you come into the hospital, you have to answer the questions about, you know, whether you've had any contact and whether you've had any symptoms and your temperature's checked. And little things like at 7 o'clock in the morning, there's a big queue to get into the hospital, and you know, my daughter's an intern, and she was complaining, you know, when they were taking the temperature in her ear that they were touching her face, and, you know, should they be touching her face? And so there's been lots of anxiety about that. There's been lots of anxiety about whether there's enough personal protective equipment, and, you know, should we all be wearing masks? Should we not be wearing masks? So there's been a lot of debate within the hospital about that. I think it's pretty clear that there is enough PPE around particularly as we have so few COVID positive patients. So that doesn't seem to be an issue. So people are kind of calming down about that. But we've made it really clear that we need to communicate all this with the staff, particularly the junior doctors, senior.
And how are you doing that? Are you using technology? Like, I know most of your meetings have all turned into Zoom.
Yeah, all the meetings are pretty much as a combination of Zoom and from an office in the hospital. But each week we're putting out a newsletter to all the junior doctors, telling them what's happening and updating them on what's going on within the hospital and any changes that have been made. We've altered rostering so that the hospital is prepared, so if there were a whole lot of cases to come in, that we actually have a special, what they call respiratory precinct, for all these ones that are COVID positive, up on one floor of the acute services building, and have specific junior doctors to look after those areas if that was needed, but it doesn't seem to be needed at this particular time.
Well, you're saying also that IVF and that has stopped. That would be for people that are doing it for quite a long time. That would mentally be very hard for those women. Have you got something backed up for them to sort of understand and take them through that process, especially if they've been doing it for 5, 6, 7 goes?
Yeah, I mean, I think the good news is it's only been 3 weeks,
yeah.
But I think it was a big blow to all those couples who were going through it at that particular time or about to start treatment. So that was really hard. Haven't really done anything other than letting them know that they couldn't do it, and they're about to start again, so everyone's on the phone busily, you know, ringing in to say, when can I start, and that sort of thing. So it's about to start happening, and that's the same with elective surgery, both in the public hospital and in the private hospitals as well. So the not so urgent surgery will all start happening again. So things like endoscopies, colonoscopies, laparoscopies for pain and endometriosis, those things will all start happening again.
Getting on to the SSMRF, we obviously both sit on the board there, and some decisions we were making for a not-for-profits. There has been money given to the not-for-profits, but in saying that, we can keep that going, but with the research, how have you seen that change? I mean, because there's social distancing, all that sort of thing. How have you seen that change? You do a mother and babies, sort of research, and you're one of the recipients of our grants. How has that changed?
Well, I mean, basically clinical research, which involves patients, as opposed to laboratory-based research. Laboratory's fine because you can keep going with that because it doesn't involve contact with people. But clinical research involves dealing with people, so that has had to stop essentially. So all that research has just gone on hold while this coronavirus thing has been happening. So,
right. And has any of those resources been driven over to the coronavirus?
Not really.
Or are they different types?
Yeah, they're not, no. I mean, at the moment it's just we're not seeing patients, and we'll have to catch up with them after the virus is on its way out. So
with the MRC though and the gut research, is that gut research, because we were looking, well, the doctors were looking, not me, who sells cars, we were looking at the gut and what it looked like as a healthy person to when someone gets sick or say coronavirus. Is that sort of something that would be in the future be able to be used in that area? Who
knows? I mean, I think with the Microbiome Research Centre, the we're at the stage where we are looking at what happens in disease and comparing it to normals, as you say, but whether we can actually intervene with the gut and do something different to improve things, that's really the next step. So you need to, first of all, you need to find out what is happening in a particular medical condition, and then the next step is whether you can then intervene to change that medical condition by altering the microbiome. So I think it's really just paused it at the moment, and it's just a matter of keeping people paid and in work. And so a lot of people will be looking at their data and writing up their data and making sure all their data is up to date while they're not able to actually physically see the patients.
Well, that's because, I mean, it's a grant-based, so it's not like you can say we lost 30% of our business, so therefore we're entitled to some help from the government.
Yeah, I think probably the government the government has, I think, done a good job in terms of supporting, well, business and people, individual people at this time. So I suspect with grants that come from government money, they will look at, saying that you can defer how long you'll get with this grant. So instead of the grant finishing after 2 years, it'll finish after 2 years and 3 months or 2 years and 4 months.
So they can give them time.
So yeah, because you can't suddenly have to stop for that time and then expect people to get results in that time.
So looking at it though, from where we were before the, virus, to where we are now, and the way that the hospitals have all pulled together, the doctors have pulled together, the juniors have pulled together, everyone seems to be doing their thing. What can you take out of that to move into the next stage, is when we start coming out of it? What does that look like as far as you are concerned in your business and then the hospitals?
I talk to my pregnant women. What I say to them now, that this current generation is going to be completely different in terms of hygiene than what previous generations were, because they're going to grow up in this new world which is going to involve hand hygiene. And already there are, I can't remember the numbers, but there were less than 100 cases of influenza in April this year, compared to something like 2,000 in April last year. So all those viral infections are going to be so much less than what they used to be. And I think that's going to roll over into hospitals as well. So I think people are just going to be a lot more aware of the need for hygiene, which I think everyone assumes used to happen in hospitals, but often it didn't, not as well as it should, and not certainly how it's practiced now. I think personal distancing is going to be how we live our lives now. So there's going to be a lot more telehealth in medicine. So
that's an interesting. That was my next question to you. Have you noticed that a lot of other doctors, etc., are using that form?
Yeah,
I know that a lot of the GPs are. For
yes, I mean, it is very difficult to examine someone over the telephone, but you can actually talk to them. Yeah, so and that's the real problem. I mean, a lot of the time you don't need to physically examine them, but if you do, you obviously have to see someone physically. But I mean, a lot of follow-up visits. People that are like diabetics, for instance. I have a number of diabetic pregnant women, and they just stay in touch with their endocrinologist by electronically, and that's always been the case, but it will be more and more.
The technology is just that base of it has come off as well too.
Yeah, and I mean, I think companies like Zoom that provide those apps, I mean, they're really going to improve their technology.
Well, even the mothers going and doing their classes that you have set up for them, before they come, even getting a look through the hospital, all of that is videoed now.
Yeah.
All of that is on the platform that you can have a look at and learn different things via that platform.
Yeah, and I mean, I think, you don't, lacking that personal engagement that you have if you go along and you see, you lose things in that. I mean, because one of the things about antenatal classes, which is what you're talking about, is that all these couples go along there and they see all these other people who are equally as anxious and know as little as they do about it all, and that's reassuring, and that's something that you don't get when you're doing it by online.
Yeah. So, but what about even looking through the hospitals? The bookings of the hospitals must have come down because they haven't been able to go through and see which hospital to choose.
Yeah. Well, I mean, there are a whole lot of things changing at the moment. I mean, private insurance is not as people are, have got. If they were short of money and because they're out of work, they're going to cancel their private insurance. So that's one of the things that they're going to lose. But the private hospitals are, they're trying really hard to provide those alternatives for people so that they can do a virtual tour and have a look. But it's never going to be as good as actually having a walk around and have a look at that.
So probably the one positive we can take out of it, even though there's a lot of negatives, is obviously everyone's looking into hygiene and taking that forward to the next step. One thing I can say out of it is, obviously we both believe in the SSMRF and research. To me, that's where, if you've got any spare money, that it should be going to at the moment, because if you can look into the background of our researchers and looking at different ways of coping with disease and bringing the microbiome back to where it was, is something that I really believe in, and I know you do too. And research needs to be funded. And there's so much out there, and I know people are strapped for cash at this particular time. But when people get back on their feet, not only are they needing money, we're also needing support from our community. So they can jump online to the SSMRF website and have a look at that as well too.
Yes.
Well, thank you, Greg. Thank you so much for empowering this afternoon. It sounds like the hospitals and yourself are all over it, and we should feel very relieved that you're stepping up.
Well, I think people should feel relaxed in this area that we are doing well, and I think the population is doing well, and I think it's because people are compliant with all those hand hygiene and social distancing, and people are by and large following the rules, and that's why we are doing so well as a community. And I think it is bringing people together as a community as well to because we're doing things for one another. Really.
I think so. I think it's the love of the community that you're in, and what are you struggling with? What have you? Don't always look at the negatives. Be more supple. Be able to move with what's happening, and so that we'll still be here when it's all finished. We've got our health. We've got our safety. Financially, everyone's copping it. There's a few different companies that have done quite well out of it. But I think it teaches you what sort of a personality you have and how strong you can be when you need to be.
Yeah, I think it's about resilience really, and whether you can be flexible and adapt. For a lot of people, I think some people, you just can't cope with it and you're out of work. But for a lot of us in business, I think in particular, you do have to adapt and go with it really.
And I think you have to ask around your friends and just make sure. The ones that you would think are the big, strong, tough ones, are you okay? Do you want to just, social distance and have a chat? So I think the non-judgment, if you do see, two best friends walking down the street talking, there might just be a reason that they're doing that. It might not be that they want to break a rule, but they might just need each other at that particular time to talk about how they're also being the mother, the wife, the school teacher, whatever. Is us, don't ever judge, just always say there might be a reason as well too, but do self-isolate if need be. And
it's really interesting, my pregnant women who are coming in, because they are so dedicated to the self-isolation and things, they're looking on their antenatal visits as exciting and something to look forward to because they get out of the house to come and see me.
Okay. Well, thank you very much, Greg. It's been wonderful to talk to you as always.
Thank you.